can you have a medtech or a health tech business without AI anymore? Is that possible? Like, would you look at it if it doesn't have AI? How much is that playing a part in your decision making?
Do you even see deal flow that is a startup without any AI element these days?
Yeah, that's probably the
It's been
better
a long
question.
time since I've heard of anyone trying to raise capital that isn't .ai something.
Yeah, that's a great question.
Welcome to Startup 360, the weekly show from Startup Daily, covering everything happening in the world of tech, startups, innovation, and the wonderful people behind it. My name's not Simon Thompson. I'm AJ Koch from Startup Daily, filling in for Simon this week as he's gallivanting around Sri Lanka on holidays. Who knows where he is, but he's probably tracked down some sort of founder or government representative to grill them on their innovation community. Very excited to be joined by a wonderful guest co-host today, Claire Bull, who needs no introduction, and I probably can't give one because you just do too many bloody things.
I do too many things.
I don't
Too
know
many hats
where
I
we'd
wear
start.
and a generalist. Yep, I love all things startup, innovation. Got a little bit excited about rural and regional startups lately too.
Okay.
It's my latest
Okay.
passion.
Very nice.
Yeah.
Well, today we are squarely focusing a little bit on the medtech world
Yes.
in honour of Digital Health Festival, which is happening in Melbourne this week. We're probably the only people not in Melbourne for it.
Yeah, is that how we got on this podcast? Because we're the only ones left
Pretty
in
much.
Sydney to do it.
Yep, we're the bench warmers that have been called up to the big leagues for today. But we are coming to you in podcast form, as well as YouTube form and on Startup Daily. So please subscribe wherever you are watching or listening and tell your friends. And thanks for joining. Do need to shout out to Vanta for their wonderful support of this show. Vanta are helping startups unlock market opportunities through automated compliance. So make sure you go check them out. We talked about Digital Health Fest. We talked about a little bit of a medtech slant. We've got some wonderful guests on today.
Very excited about them.
It's going to be fascinating. But to start off with, we've had a bit of medtech news in the headlines this week.
Yeah.
Just a couple of days ago, a juicy one. Old mate Liz Holmes from Theranos fame, currently in jail for an 11-year sentence. She's sort of resurfaced a little bit. Her partner Billy doing the rounds, raising capital for, would you believe, a blood testing startup. That
100%.
sounds eerily familiar.
This is wild. I was actually looking this up after we spoke about it. So Theranos is obviously a ancient Greek god. And the new company is called Heymanthus. I probably am saying that wrong, definitely saying it wrong.
Sounds like you nailed it.
But
your Latin is
it
exquisite.
Thank you. Which is a Greek word for blood flower.
Greek, sorry. Okay.
Yeah.
There you go.
So really interesting that they've almost copied the naming convention, everything to come out and do
was
this.
April 1st, you'd think this was a bloody joke.
We couldn't make this up, could we?
Are they serious?
We couldn't make
Or
it up.
Do you think it's just absurd, or with the fame they've gotten and the hype that was built, like, is this a genius move?
Yeah, I don't know. It's absolutely wild. And I think someone will fund them. Like, I feel like that someone will fund them. And that kind of is frustrating to me on a level because I'm like, there's all these amazing founders we've got here doing wonderful things in this space that are probably real who will be struggling to get funding.
Yep. It's
Yeah.
amazing what a bit of hype can do.
It really
The big
is.
old land of opportunity over there.
Yep.
Speaking of amazing medtech founders, Heidi Health was in the news a little bit this week for becoming the fastest growing ever portfolio company within Blackbird's portfolio.
Faster than Canva.
Faster than Leonardo, which is amazing because they're a young company, not the household name that Canva and Leonardo quickly became.
Yeah.
But just absolutely killing it with incredible sales volumes, customer growth across many countries. It's amazing just what we're doing in the world of health and medical. Yeah. Obviously, which is getting the spotlight this week down in Melbourne at the Digital Health Festival. But
absolutely. And it's cool that, I mean, it's B2B, right? And so it's just really cool that there's adoption, that there's clinicians out there that are willing to adopt this technology, that the health space is changing. I love that. I'm excited about that because traditionally, medtech and health tech has been slow. It's been the slowest moving sector. So I'm really excited that this has happened for them.
Very nice. Yeah. Well, I mean, speaking of great up-and-coming startups taking the stage, we've got a bit of coverage from down in Melbourne.
Yes, because we are fill-in co-hosts and we can just do like whatever we want.
Whatever the hell we want.
We decided we'd employ a Melbourne correspondent, and we're actually going to cross to him now, Dickie Curra.
The hype man himself.
Yeah, we're going to cross to him now for a little bit of an update on what's going on at Digital Health Fest. Over to you, Dickie.
Thanks, Claire and AJ. Yeah, I'm at Digital Health Festival here at the Melbourne Convention Exhibition Centre. Been here for the last 2 days, and it's been an incredible event. So 8,000 attendees, over 400 startups and speakers, and really is testament to the strength of the digital healthcare sector and health tech in Australia and how we really are leading it in the region. Some of my highlights, seeing some of the startups that are here. There's tons of startups pitching in the startup village and on stage, and seeing some of them progress. The team at Livelihood Health, I got to introduce Kai yesterday, the founder, and he was telling us about their incredible growth over the last 2 years, starting in the startup village and now being on the main stage at Digital Health Festival. And I think the other key takeaway for me is how many customers are here. It's very rare at innovation and tech event that you get so many of your potential customers as a startup actually in the room. Here is the whole healthcare ecosystem, government, enterprise, and all the hospitals and health associations as well. Incredible event and a real testament to what we're doing here in health tech in Australia. Back to you in the studio.
All right. How good is that? I mean, the conferences like that, it's incredible the impact they can have when, it's a different world since COVID with everyone working a lot more remotely, but nothing will replace the opportunity to come together at events like this for the opportunities that can come.
Definitely not. And especially loved what he said about customers being at the conference. I do think in the startup ecosystem, we can get a little bit guilty of just hanging out with each other and kind of just having, other operators, other startup ecosystem people, just kind of having a bit of a catch up. And I think that it sounds like at Digital Health Fest that's different. And there's customers there and you can riff off ideas and you can really look at getting, market validation from having conversations straight with your customers. That's really cool and something that I would love to see more of in Australia. Why can't we do more of that? We're existing in a little bit of a startup bubble. Let's get ourselves out there more.
Completely agree. So we got a bit of FOMO up here this week.
We do. There's real FOMO.
But you and I, we're no strangers to a startup event. That's for sure.
That's true. I think we met at a startup event. I actually met Dickie at South Start startup event.
There you go.
So, beautiful. This wouldn't be happening today without startup events.
What's your standout on the calendar of startup events?
So I've probably got 2 faves. I love South Start in South Australia and I love Something Tech, which is held up in Brisbane on the river there. Really beautiful. They're probably my 2 faves. And I think I like them because everyone is traveling to a separate place and they are really physically and mentally present. I think, unfortunately, a lot of the events that happen in Sydney and Melbourne, people are running off to meetings and other things and life gets in the way. But when you go to those 2 festivals, you are out of your day-to-day space and you really just spend time creating probably deeper connections with people because you're really there having longer conversations and I like them. How about you?
Love it. Both of those I'm a big fan of. I always love Intersect down in Melbourne, the FinTech conference, partly because it's similar in size to those ones, but everyone is jam-packed into a tiny space and it's like sardines, but it has a cool impact.
It does.
And it's just a great big reunion for people.
Yeah. And I think Melburnians, especially post-COVID, just love a conference, love an event. I've really noticed that.
I mean, obviously the best event of the year is the Startup Daily Awards.
Clearly.
Which are coming up in
that goes without saying.
A couple of months. So everyone get their applications ready. We'll be announcing that soon. But
awesome.
Moving on, the other big news this week, which were some of the most viewed on Startup Daily, bit of the shuffling around in politics. Obviously, off the back of a Labor win, the much-loved Ed Husic was showing the door, and the hopefully wonderful Tim Ayres is coming in to his place, taking over the portfolio. been a
Emotional.
bit
It's been
emotional for people. Yeah. A lot of people were very sad to see Mr. Husic go after a very good couple of years of just absolute passion and support and dedication to the startup sector.
Yeah. I mean, I wanted to say it's like an outpouring of grief, but he hasn't died. But that's kind of been the sentiment, is like just grief in the sector from a few people. And I know myself, if we're talking about, conferences and things, often at the beginning of a conference, there's some kind of parliamentarian that might be speaking. And I think, I'll just skip over that bit. They're just going to say the same canned things that they always say that I can read online. But Ed wasn't like that. He always had something really interesting to say. He understood the sector, and he was really doing some innovative things because he got what we needed within the sector.
All things that you can't say too often about politicians.
Yeah, exactly. And so, it is a little bit of grief at him going, but hopefully something great will happen with Tim. But I just think for me, it's about the loss of consistency and the loss of building on what he had done over his time in the portfolio. Now we've got to kind of have someone new, and we don't know what's going to happen.
Absolutely. Yeah. It really felt like there was a lot of good momentum going into this next term, and all the sector wanted was a bit of stability and continuity. And
absolutely.
Now we've got another big change. Not saying it can't be fantastic, but Mr. Ayres, you have some big shoes to fill if you're listening. We'd love to have you on to talk about it, of course. Yeah. But there were certainly some strong comments out there in a bit of the Startup Daily coverage. We had Alan Jones from Mate Ventures basically saying, because Ed Husic genuinely cares about the tech industry and believes it's key to our economic and social future, that's what hurts the most. We obviously care more about short-term inter-party factionalism than we do the innovation industries. And would you believe probably the most vehement comments came from an 81-year-old in former Prime Minister Paul Keating, who had a lot of things to say, one of which was that this decision represents an appalling denial of Husic's diligence and application in bringing the core and emerging technologies of the digital age to the centre of Australian public policy.
Scathing.
Now, when you get an 81-year-old saying things like that.
And I think he probably knows what he's talking about
absolutely,
too. So, it's
going to be interesting.
Yeah, it is. And the other one to talk about as well is obviously first ever female leader of the Liberal Party.
Yes.
Susan. Yep. Interesting. Very accomplished, has been across a lot of portfolios in her career. And interesting for me is she's regional from Farrer electorate, so understands.
Where exactly is Farrer electorate? For those others in the audience aren't familiar with it?
It's down towards Deniliquin, which is actually where my husband happens to be from. Yeah, so down near Denny. Yeah, down in kind of southern New South Wales.
Partaken in the Denny muster?
I have partaken in the Denny Ute muster.
Excellent.
I'm not sure there's much I can say about that on air. It was a very, very interesting experience. I actually worked in the souvlaki stand, raising money for the Denny Tennis Club, selling souvlakis at 10 a.m.
Fantastic.
The morning after Powderfinger performed, actually. Very, very interesting times.
All I've heard is that dusty is a word used to describe many facets of the muster.
Yes. That's like another one people can Google after the show.
Sounds like a good old shindig. All right. Well, what else are you doing at the moment? Before we get our first guest in, what are you working on? Anything to plug? What's happening in Claire Bull world?
Absolutely. So I've been doing a lot of work for ACS, Australian Computer Society, which you may know of, who run the Something Tech Festival up in Queensland. A lot of work with female founders, and actually there's a great digital program there, The Labs, which gives access to an amazing accelerator program online for founders and an amazing community. I'm one of the mentors in residence there, so a little bit biased, but we've got some fantastic founders from coming all over Australia that are part of that community that ACS is running, and a lot of those people are going to meet together up at Something Fest in August. So if anyone hasn't looked up Something Fest and Something Tech, would love you to come along and see what being part of the Labs community is all about.
Amazing. It's a ripper, and sounds like you got insight into a couple of good up and coming startups that we might have to add to our brand new S360 watch list. We're starting this on the whiteboard today because of our first guest, Emerald from Main Sequence Ventures, who is going to come along with a couple of health tech or med tech superstars in the making that we might not know about. And each week we're going to jot them down and keep adding to the list to just have a nice little watch list of some of the budding entrepreneurs that are coming through the ranks.
Yeah, can't wait to hear what she says and
Well,
what she's got.
On that note, let's get into it. We'll welcome Emerald in and be back in a second. So we are back with our first guest of the day, Emerald Scofield, Associate at Main Sequence Ventures. Thanks for joining us.
Thank you.
So you focus on a couple of different areas at Main Sequence, medtech being one of them. Give us a bit of a state of play in medtech and what you're seeing at the moment at Main Sequence.
Yeah. Well, so for a bit of background, Main Sequence has always kind of invested in the healthcare space. But when we launched Fund 3, we hired 3 new people in the healthcare space, myself, Dr. Elaine Stead, and Alex Romero from Uniseed. And so we went through an exercise of, I guess, relaunching our healthcare thesis as a fund. And so we're now looking at, we're sector agnostic, or product agnostic. So we're looking at medical devices, diagnostics, therapeutics, and digital health. And so with that, we went out to the market and said, hey guys, we're a fund with money that's investing in this space. And so we got an influx of amazing innovation. I think that the state of play is there's some amazing startups in Australia that are working in the medical device and diagnostic space, if we're talking specifically medtech and also digital health. I think the thing that's interesting about medtech is that there's not a lot of funding for medtech in Australia. So a lot of the funds are skewed toward therapeutics. And the reason you see that is because therapeutics have very large exit potentials, a very clear market, and realistically you're just investing in like a technology risk. Is this asset going to play out? Whereas when you look at medtech, you're compounding technology risk with market risk, and then you also have a consolidated group of kind of acquirers that sit in that space that kind of drive down the valuations of the exits. And so if you look at a fund in the space, they're probably going to go towards something that's like $1 billion exit or 2, 3, 4, those blockbusters versus a smaller exit with more risk associated with it, which is a real shame because Australia has a history of like fantastic medtech innovation with, Cochlear and ResMed, and obviously some amazing research, but we obviously need to bridge that gap to commercialize it more and make sure that it has the impact on the world that it really could have. And because
it really seems like we do have a pretty flourishing medtech sector. A lot of people talk about how we punch well above our weight in the space, but how's that possible then if we're constantly battling with this kind of funding gap? And obviously one of the big challenges, it's just such a long roadmap for a medtech to even get any sort of return for investors, and going through years and years of clinical trials and then distribution and whatnot. So are we really doing that well? And if so, how? Or is this just something we like telling ourselves?
Look, it's kind of hard to tell. Like I don't have the numbers in front of me, but I think the thing is there are with Australia, we've got fantastic founders who find a way forward, right? So they'll find investors who can get them to a point where they're able to access the US market or the European market, and they find their way there. It's the sad reality is they're going to have to go offshore to find the funding, a lot of them. Or they go down like a listing route, and realistically the ASX doesn't quite understand kind of med-tech. Even though we've got listed companies there, it's more of a therapeutics type skew. So I think it really just comes down to fantastic hustle from founders. And then there are obviously, and me saying that, funding for medtech is hard. Obviously there's great companies that have great exit potentials. I think that reality with any deep tech startup, right, is it iterative or a game changer? And so a lot of the time in medtech, you often see it may be slightly iterative, a better orthopedic implant or a slight change in a clinical practice. And obviously that takes a long time to adopt, and you often see clinicians change and generational shifts for things to be adopted, so the exit is much smaller. Whereas if you find things that can save someone's life or have a massive market impact, of course there's going to be funding there. And that's the ones that we have seen funded in Australia, and they've gone on to do incredibly well. And there's some really exciting ones here, which I can talk about later. But yeah.
And that brings up a really interesting thought for me. When you are evaluating these companies that are asking you for funding, how do you weight that like pure grit, resilience and passion of a founder with the tech that they're looking at implementing? So I think in a lot of cases, you know, you hear investors talk about the founder is so important and they can make decisions just purely off the founder's passion. How do you weight that, the actual resilience of the founder, knowing that the road ahead of them is going to be so difficult?
I mean, it's probably the first thing that we'd look at. Also the team that they've built around them. You know, it's the clinical experts, it's the people that understand the distribution strategy, it's who's going to open doors for them. And then looking at, you know, but obviously there's a very, very strong lens on, obviously, does the technology work, but do they understand the path to market? You know, how are they going to get there? Who are they partnering with? How do they understand the reimbursement strategy? Do they understand what needs to change in clinical practice to see adoption there? And that actually is predominantly what we spend most of our time reviewing when we're looking at these startups, because it is where it often falls over. It's a very expensive process. It's time consuming, and a lot of things can go wrong in terms of even getting regulatory approval as well. So we're definitely trying to judge, A, have they got the determination to do it, which most of them do. Like they wouldn't have jumped into it if they didn't.
Yeah.
But it's also, you know, do they have the ability to learn on the go and understand when to bring in the right person to support them to do quite a tough path around actually getting it to market. I think that's really where a lot of our lens goes.
Yeah, totally. And we were discussing before we kind of caught up, can you have a medtech or a health tech business without AI anymore? Is that possible? Like, would you look at it if it doesn't have AI? How much is that playing a part in your decision making?
Do you even see deal flow that is a startup without any AI element these days?
Yeah, that's probably the
it's been
better
a long
question.
time since I've heard of anyone trying to raise capital that isn't .ai something.
Yeah, that's a great question. If you look at kind of the funding landscape that's happening in VC and PE for medtech, there's been a decline over the last 2 quarters that are going into medtech, so devices and diagnostics. But what we've actually seen, the most number of deals that have been done, or like in the top deals, have been AI driven. But the reality of that is not necessarily generative AI, but using AI to, I guess, improve existing practices, like Harrison AI, which recently raised a really fantastic round. Great founders, awesome product.
One of the superstars of medtech world. For the past
Fantastic.
10 years.
Yeah. Awesome. And so we're seeing people that are going into well-trodden, well-established companies that are doing, you know, integrating AI into existing things. Generative AI is a little bit slower, obviously, because the medtech world, or even just the health world, is like 30 years behind. They're still using faxes. So if you're putting generative AI when they're still using faxes, I'm not sure how that's going to work. So we're definitely seeing companies that are raising that aren't using AI, particularly kind of like the medical device space. Obviously, that's less so. I would say they're the minority now. But, you know, I think it's just kind of the status quo. Who has the best data as well? That also comes back to it, like access to data and all those other things. So it's an interesting space to keep an eye on.
Okay. Well, speaking of keeping an eye on things, obviously there are some standouts, like you've mentioned a few, the Harrisons and the Cochlears over decades. A lot of them doing AI before anyone knew what AI was, or certainly before generative AI was a thing that average Joes on the street knew about. But we want to start keeping an eye on some of the up-and-comers. Are there any superstars that you're seeing that we don't know about yet, or that we should be adding to our little Startup 360 watch list?
Totally. Okay, so I've got 2. Baymatov, if you guys haven't heard of them before, great founder, Tara Croft. They're working in the postpartum hemorrhaging space. So if you look at, we're in 2025 and we still have women that have, you know, horrific hemorrhages post giving birth. They go through hysterectomies and have long-term damage from it, or can die, which is insane considering we're in like the 21st century. And the reason why that happens is because we're operating on subjective risk stratification of people giving birth. And so they go, we think this person's high risk. We're going to monitor them. And so it requires a lot of resources to monitor them. But not all of them go on to have a hemorrhage. And so what Baimatob has done is they've developed a non-invasive device which allows you to objectively stratify patients and identify who's most likely to have a hemorrhage, and then actually communicate with the person that they're likely to have one, and then have a much more collaborative process if they do hemorrhage, and it's less traumatic. A lot of the time, they're hemorrhaging for 12 minutes before someone starts to do things, and then it becomes absolutely chaotic, right?
Wow.
And they're not getting communicated. They're literally on the brink of death, right?
Yeah.
And this company is innovating a way to make sure that women can kind of come out of that and not.
Wow. I mean, that for me brings up a really interesting question around how much are you seeing around female health startups and med techs? Because as we know, a lot of the research has traditionally been done on males, for males. And how much are you seeing female founders or female focused med tech and health tech businesses starting up?
It's a great question. So when we actually redeveloped our thesis as a fund, we've specifically outlined that we want to invest in women's health and not just reproductive, because that seems to be where a lot of the funding goes to. It's can we birth children rather than the whole reproductive life and, you know, the reality of like menopause and how it affects your actual mobility and your cognitive decline and all of these other things. So we did like an Australia-wide search of amazing innovation in space, talked to some of the leading experts in academia around this and also clinicians. And there's a lot going on. Yeah. There is a lot going on. And, I'm actually really, really excited about. We've looked at a lot of women's health-focused ones. Another one I can talk to at the moment is called Sapphire Neuro. And they're doing neurostimulation for managing of symptoms to do with menstrual health, so pain and mood disorders. And the reality is, like, most women at the moment, or AFAB, they go through the most, horrific pain and mood swings while they're having their periods, right? And they can't communicate within the workplace a lot of the time around that. It's quite a taboo topic. And they're like, okay, take painkillers. Okay, well, what is that going to do in the long term? Yeah. Is it really that bad? Take like contraceptive pills. So this one, you just wear a device for 20 minutes in the lead up to your period, and you have it's early data, but like you can essentially have reduced pain and reduced mood symptoms, which is amazing. And like I would be the first one to put my name up to buy that. That's insane.
I think there'd be a few billion people
putting their name up pretty quickly. We say would be up.
Wow.
Yeah, and some amazing female founders that are running these companies, just absolute grit and hustle and building these fantastic businesses and communities around them. The thing that we see around women's health is like, you need to build a community around this. It's going to be your product, like your customers, obviously, but they're all talking with each other, all sharing experiences, particularly in the menopause space where you don't actually know a lot of the time that you're going into perimenopause. It's still an educational piece. Anyway,
amazing.
You tapped on something I love.
I could do a whole episode on that, so I won't.
Good ones for the watch list. Tell us again the names.
So Baimatob and Sapphire Neuro.
Baimatob, Sapphire Neuro.
And I think I interrupted you. Maybe you had another one that you were going to say, but I took you down.
Let's go with those two for now. There's heaps.
Unreal. And I mean, we've jumped straight into the juicy topics, but what's your story? How did you end up in this role? Tell us the background. There's a hint of an accent there.
Yes. So I grew up in New Zealand. I was 16 and decided I wanted to take down the pharmaceutical industry from the inside.
Oh, nice.
Yep. Realized very quickly I don't think I could do that. But I ended up doing a biotech degree, and was like, wow, science is really interesting, but I'm going to go crazy if I keep doing the same thing in the lab over and over. Love to see things be commercialized. I found this really interesting startup doing xenotransplantation of pig kidneys into humans. I was like, I want to go work for them.
Can you just say that again? Xenotransplantation. And so what is that?
Essentially, you take so xenotransplantation means you taking an organ from another species and implanting it into someone else, so a human. Really interesting startup. I ended up approaching the fund that was supporting them. I turned up to the interview with my mum. I was that young. I was in my, well, not that young, but still. Anyway, that's my running joke with that fund. I can't believe they hired me. But they were like, well, we're not going to let you work for them. I don't think they need staff right now, but why don't you work for us? Admittedly, I didn't know what they did. I was in my second year of university. I was like, yeah, I'll take an internship. That sounds great. And I fell in love. And so while I was there, it kind of grew into like a managed fund. And I seconded into a medical diagnostics startup where we raised, as operations manager, and we raised, I think, must have been 8 to 10 million, grew it from 2 to 22 people. Then worked on another medical diagnostics startup and that's gone on to do some great things as well in the skin cancer diagnostic space. And then the way I got to Sydney was I ended up working with this amazing team from University of Sydney and jumped in as acting CEO of their startup in the climate tech space.
Yeah.
Started to fall in love with hair and met the Main Sequence team. And the rest is history. I've been with the Main Sequence team for a year and a half now. I love it. I'm so spoiled. I have the best job in the world and work with amazing founders. So yeah.
Unreal.
Yeah, that's my story.
And do you keep tabs on what's happening in New Zealand startup and medtech area as well?
Yeah, lots of medtech innovation in New Zealand, like a lot, far more than therapeutics. There's no real funding for therapeutics too much over there. So really interesting stuff happening. Katia Health was one of them. They're doing brain pressure shunts for, I guess, encephalitis. So you're able to have better confidence around whether you actually need to go to hospital or not. But there's a really booming medtech ecosystem over there and some fantastic investors too.
Yeah, fantastic.
And do you have a personal issue with Sydney's hairdressers, or why do you only go back to New Zealand for getting a haircut?
Well, I use it as I make sure I go home and see my mum and my grandma. Okay. And I think if I get a hairdresser here, I won't be pushed to go. Obviously, I want to see them. So I'm sorry, mum and grandma, if you see this. I did tell her this yesterday. But it's that, and I'm very loyal to my hairdresser.
How often do you get your haircut?
Well, once or twice a year, and then I trim my fringe myself.
Ooh, that's very impressive.
It's getting a bit long.
It's a good-looking trim.
Very
impressive.
You're doing a good job.
Well done.
Yeah.
Well, that's a nice disciplined way to make sure you're visiting family and getting back there. That's good.
Yeah, it's good. Yeah.
And so it sounds like medtech rules your life. What else should people know about you? What else do you do? Or are you wholly consumed by what's happening in health?
Oh, okay, great question. So at work, I invest in obviously health tech, so medtech, and also working with the team on the therapeutic side. I also work in the climate tech space, work a lot with our food tech and ag portfolio as well. And then outside of work, I have become a professional hobbyist. So I'm picking up every hobby under the sun at the moment. If you guys are ever thinking of doing a hobby, just do it. Just sign up.
Okay, what's the hobby of choice this week?
Okay, this week I'm doing salsa and basketball.
Together or
amazing.
Separately?
Separately, but who knows?
Two of my big loves in life.
Really?
Yes.
Really?
Where do you go salsering?
I go salsering at Latin dance in Glebe.
Ah, okay.
Yep, nice. I'm doing a 4-week course on that, and then I've never played basketball in my life, and I've started this 2 weeks ago. So
fantastic.
Wow. AJ and I met playing basketball.
We did.
Okay.
That's basketball just continues to bring people
really
people together.
We need to start a team.
Yeah,
I think we were on the same team, weren't we?
Yeah, we were. Or we could start
a
some kind of like salsa basketball
Oh,
club.
I
think
love
we
that.
could.
Amazing.
Yes. So we play
Basketball first, salsa later.
to exclusively salsa, bachata music, maybe.
Oh,
and
yes.
halftime we have a little salsa dance, and then
I love this for
back on the
us.
court.
This is fantastic.
Excellent.
I think
sure.
this is a new sport.
There
we
is
need to start a league.
Yes, salsa ball.
I love it.
There is a flourishing startup basketball community
let's put
across
salsa
Australia.
ball on the
Really?
watch list.
In Melbourne, in Sydney, just last 2 weeks ago after sunrise, we had a tournament with 120 people the day after sunrise, and a big round robin tournament that's just for founders, VCs, anyone across the innovation sector.
I love it.
We'll get you on the list for next
Please
one.
do. Oh, this
And
is
we will
exciting.
add in definitely a little salsa after party.
Great. I love
Yeah.
it. Cool.
Amazing. So we might have to wrap it up, but thanks for coming along.
Thank you
Amazing
so
to hear about the
much.
story. Amazing to hear about your passions, and a good little check-in on what's happening in medtech world.
Awesome. Thank you so much for your time and the great questions.
Well, we are back with our next guest, Joshua Ismin. So welcome. Thanks for coming on Startup
guys.
360.
Thanks
We
for
need
having
to
me.
start with names because you are from the company formerly known as Xylo. Now you are Xylo.
That's correct. Yeah, Xylo Bio. So we rebranded at the beginning of this year. The company really started as a drug discovery project around natural product and computationally designed psychedelic compounds. And as we progressed with the research, we found a lot of promise in this new class of compounds, which are activating the same or similar receptors to psychedelics, but without the hallucinatory effects. And so, we've basically decided to rebrand to focus on the neurotherapeutic angle as opposed to, the psychedelics angle. It was really kind of useful early in our journey. But, as we've progressed and, as the research continues, it's really sort of important for us to not sort of advertise at the front door that we are within this category. And so it really is a new class. And I mean, from the beginning, we've been a pure play biotech company doing rigorous drug discovery, but people saw our name and they would jump to their own conclusions about what we were working on. We'd have a call with a biotech investor and they would say, oh, so are you developing some sort of, mushroom-based product or, a natural product? And that's not what we're doing at all. Yeah. So I went to the JP Morgan conference at the beginning of the year in San Francisco and, handing out the new business cards, and people were asking me, oh, so tell me about Xylo. What do you guys do? And I was like, I'm so glad you asked that question because most people haven't asked it for a while. So.
Yes, very cool.
But this isn't your first rebrand, I hear. You've done a personal surname rebrand too.
Yeah, that's true. My wife and I combined surnames after we got married. So I was Islin, she was Amin, and we became Ismin. It was... I just wasn't really comfortable with the hyphenation thing and asking her to adopt my surname. So I was like, let's try a different angle on that.
That is innovation. I've never heard of anyone doing
really?
that before.
I know a few people doing it.
Really?
Yeah,
Okay.
it's
love
a
it.
new thing.
Nice.
I love it.
Yeah.
What would your new surname be? If you
Bulldotzi.
Oh, that's cool.
Bulldotzi. I was a Lombardozzi before.
Bulldotzi.
Bulldozer, maybe?
Okay, bulldozer's cool. That'd be Koshores Carrillo.
Oh,
that's pretty long. That's pretty long.
Let's workshop that.
That's not going to work. But,
so did you just wake up one day and think I want to work in neurotherapeutics, or what happened? Because I did a bit of a LinkedIn stalk, and you've not been in this space in your previous startups, really.
Yep.
What is the kind of spark that led you to get into this area?
Yeah, so it's not an obvious one. So my background was in digital technologies, e-commerce. I worked at Microsoft for a period of time, did my own startup, and was fortunate enough to have an exit in the sort of mid to late 2000 teens. And so I used that opportunity to kind of, just explore a couple different areas. Was looking into generative AI, was looking into, autonomous cars and drones and all sorts of different areas, and just poking around, doing a couple angel investments and just trying to figure out what to do. I've always been a huge fan of Michael Pollan, the author. His book, Omnivore's Dilemma, turned me vegetarian in 2010. Yeah. And he came out with a book in, I believe it was 2017 or so, called How to Change Your Mind, which was about the development of psychedelics and their use as a therapeutic treatment, and their development as medicines. And that really interested me and excited me. I've always been a big fan of psychedelics since I was a teen, but I sort of, put that part of me to the side to, become an adult and focus on career and family and things. Yeah. And so, it felt like a really interesting area to explore. And so I started networking around academia to meet researchers and scientists who are also interested in this area. My wife at the time, Rupal, was running an incubation space at Sydney University called the Sydney Knowledge Hub. And that's how I met my now co-founder, Sam Bannister, who's a medicinal chemist by training, did his postdoc at Stanford, and has a long-standing scientific interest in this area, but also has a track record in sort of natural product drug optimization. So we hit it off and actually founded the company during a COVID lockdown. We applied to StartMate and did the entire thing virtually. At that time, I don't know if you guys remember, this feels like decades ago, but during lockdown, you were limited to a 5-kilometer radius
We remember.
of your home. So Sam and I determined that our 5-kilometer radii overlapped in a sort of sliver of Moore Park. And so we were, pretending to exercise, walking around with notepads and writing the business plan for what is now Xylo Bio.
Wow.
Awesome.
So give us a snapshot of where you're at. What's the state of play? You're international now. You've done a whole bunch of raises already. So what's that? Yeah.
Yep. Yeah. So basically, like the first several years, we're 4 years in this month. The first several years were really focused on doing this rigorous drug discovery. And so this is work that, really was not allowed to progress and just didn't happen over the last 40 to 50 years because of the stigmatization of psychedelics and also just due to prohibition. And so we really sort of picked that up when we started the company, as did several others. And so there's now a handful of companies that are sort of doing this rigorous structure activity relationship work. The stage of the company is that we've now developed several different promising series of clinical sort of potential candidates, the most advanced of which is currently preparing for human trials next year. So over the course of that time, we did flip up to become a US company, which I'll be honest, right now, I'm sort of scratching my head around whether that was the right decision. I mean, hindsight's 2020. The main rationale for doing so was biotech venture capital is predominantly in the US. The US is the largest pharma market. Pharmaceutical companies earn something like 65% of their revenues from technology that's been brought in-house from biotechs like ours that are doing this sort of frontier science. And 45% of pharma revenues are in the US. So it's the place to be. For that reason and for non-dilutive funding. But in the US, that's where the large players are. And so that's sort of, they're in many ways, they follow this index called the XBI index, which is the biotech NASDAQ index. And that index is down by 22% this year. It's down by over 50% since its high in 2021. And so, I had a conversation at this accelerator with the CEO of a public biotech company who's basically saying the only thing to save biotech right now is going to be a recession, because a recession is going to mean interest rates come down, which is going to, signal an increase to the XBI and an increase in investment activity. Challenging times, but half our team is in the US, half our team is here. There's various reasons for doing that, but I'm lucky to be a dual citizen of both places and, go back and forth quite a bit and try and take advantage of the sort of incentives that are available in both.
How did you all split up who was heading stateside and who was staying here?
Yeah, heads or tails.
Really?
No. So Sam, my co-founder, Dr. Sam Bannister. He lived in the US for a number of years and was pretty eager to get back.
It is Australian?
He is Australian.
Okay.
He's
So
proper
you sent the Australian over there
Yeah.
and left the American over here.
That's it. Yeah.
To benefit from the accent.
Just to
impact
confuse
on both
everyone.
sides.
Yeah. We have this idea that, you know, if you're different in a market, you'll stand out and you can use that to your advantage. And so,
Absolutely.
we've been trying to leverage
I've heard
that.
a lot about how impactful the Aussie accent can be as a startup over in the US. And on the flip side, to be honest, I feel like an American accent here, when we see the US as, you know, obviously
brings gravitas,
this
right?
leader in innovation and startup world, absolutely brings a lot of gravitas. And instantly you just think the person is an authority on something, even if they're full of shit.
Well, they had to get there in some way, shape, or form. And generally it was due to some academic progress or commercial success. So, I mean, maybe there's some validity there, but yeah, we try and leverage that. And it definitely keeps people on their toes when we're saying that I'm the American in Australia, he's the Australian in America.
I'm really interested personally, now you've learned so much about the brain and the science around the brain. How has that changed the way that you live your life? Are you like super conscious about what your brain is doing all of the time? Or is there anything that you've done in terms of your productivity because you know how the brain works more now than you ever did before?
Oh man, yeah, we're learning so much about the brain. So much of this stuff is coming to light, you know, just in the last sort of 5 to 10 years, the advancements in terms of how we're able to model proteins and target them accurately. I guess like, you know, really coming into this, I would consider myself fairly granola, if you guys are familiar with that term. You know, my wife and I combined last names. That's probably a decent example. And I started a psychedelic company. So, but, you know, I think my thinking around what nature has provided us relative to what's possible through science has really evolved over time. So, you know, I guess I thought, like many people in the circles that I run with, that, you know, if something is natural, it's just inherently better because, you know, Mother Earth has given us whatever this is, and therefore, you know, we have co-evolved with this thing, and therefore, you know, it's somehow better. But the reality is that nature also gives us a whole lot of things that can hurt us.
Yeah.
So, I mean, it's just some sheer luck that the sort of evolution of a certain plant has some effect on a person, and that may be therapeutically meaningful. So I guess, like, you know, I hope this is kind of answering your question, but my thinking has kind of evolved around we can actually improve on what nature gives us. Yeah. And that's sort of driving a lot of the work that we're doing at Xylo Bio.
Yeah. And interesting reading your bio and thinking about nature and things that can kill us. You have ocean swimming as one of your key pursuits on your bio.
Oh, yeah. Shark
attacks in Australia.
Not something you'd see too often from someone with Boulder, Colorado as
no.
LinkedIn
So yeah, like
location.
talk to us about that, because obviously if you're putting it on LinkedIn, it's a passion and you love it.
Oh yeah.
Tell us about that.
Yeah, super passionate ocean swimmer. So I used to be a runner. I was a cross-country runner in high school, and I used to just run for fitness all the time. My parents forced me to do swimming school and like training and squad when I was really young, and I quit as soon as I possibly could. And so I really did not like swimming. And then I had a couple of injuries. My brother had 2 hip replacements. He was a competitive tennis player. And my dad has had like more surgeries than I could count. And I was like, I think it was around when I was 30, I was just like, I'm not going to do this. Like, I'm setting myself up for disaster here. I'm going to try and just like switch to swimming, which is no impact. And, you know, it works all the muscles and everything like that. And so started pool swimming. and gradually improved, and then flipped to ocean swimming when I moved out to the beach. And I absolutely love it. I go every day.
Yeah.
And actually last quarter, I got my bronze medallion, which was
Oh,
amazing.
yes. I did
Where do you
that in
go?
school.
I did it at Coogee Beach. And Coogee Beach is really interesting because it's the best swimming beach in the world, in my opinion.
Yeah.
Great swimming beach because it's kind of a cove, but you do get swell. But also the way the beach is set up, they actually get a lot of spinal injuries. So the training for bronze medallion is super rigorous there. You're dealing with less kind of like, rips and things like that. And it's more about spinal rescues. So, really proud to be a bronze medallion. I've been going to the, Surf Lifesaving Club every morning and then, hanging out with the salties before going to work. It's pretty spectacular.
You're a real
Yeah.
Australian now.
Oh, yeah. My kids are in nippers and I do water safety with them. So it's anyone considering doing that, I highly encourage it. It's super rewarding and like great community feel. Met a lot of people in my hood.
So it was really interesting, and you touched on at the beginning when you were younger, and I watched a TEDx talk to prepare for interviewing you, and you had a photo of your 17-year-old self and said, that 17-year-old would not believe what you were doing today. Love to know what you would say to that 17-year-old version of you.
Oh my God. Oh, man. I think the first thing, like when I think about adulthood and the transition to adulthood, I really think about it's a transition from really being steeped in like a FOMO sort of mindset and moving into, sort of like a enjoy the moment mindset instead. So I think I would encourage myself not to be so wrapped up in what you're missing. I think, this is off topic, but like that's what I think is a lot of plaguing society with social media, et cetera, is that like the whole enterprise is centered around what other people are doing and why am I not there and why am I not enjoying, this time as much as like, why don't I have what they have, et cetera?
You almost can't be grateful for what you've got right now.
Yeah, exactly. And so, I think I would encourage myself to not get so wrapped up in what else you could be doing and really focus more on what are you doing right now and are you, really appreciating the moment.
And it sounds like you found that doing a startup in your passion area as well.
Yeah, that I would agree with that. My last startup was really a commercial enterprise. I saw a business opportunity and like worked really hard at it. And that was great. But when I was doing that searching around, I really wanted to get involved in something that was impactful and meaningful. And when I would talk to my wife about it, I'd be like, I want to find something that I can explain to my kids and they will understand it. And, I can be proud of it.
Yeah.
And I really do feel like I've found that. There are so many people who dedicate their lives towards curing disease and helping people. And I'm really proud to be surrounded by just brilliant scientists that are doing that and working hard to do it.
And if you were to make a prediction in terms of how far we're away before this is commercialized and commercially available, what would your best case scenario be on that?
Yeah. So biotech is a long road. It's a super, risky road. And there's a number of sort of wrecks on the side of that road that you need to drive past as you progress. We've arrived at our first development candidate, planning to be in the clinic with that candidate in sort of Q2 of next year. So the clinical trial pathway, so everything we're doing, the regulatory pathway is fairly well trodden for therapeutics. phase 1 clinical trials all the way to phase 3, seek approval, and then your drug is available to be prescribed. Best case, that sort of path could be sort of 7 years.
Yeah.
Worst case, it could be 12 or more. I mean, there's plenty of examples where it's more than that. But the way that you set up a biotech is that you're both progressing into the clinic as quickly as you can and also diversifying your pipeline so you have multiple shots on goal. Yeah. So we have our first development candidate, but we also have several other programs that are sort of staggered at various levels of progression behind that.
So you mentioned before, and I don't know if you were joking or a little bit serious or maybe a bit of both, around the US side of things and whether that was a good decision in hindsight. But seriously, right now, would you, if you were doing it, if you were at the point now deciding to go international, is the situation in the US politically, tariff-wise, socially, a big enough issue to turn someone away from expanding into the US? Or is the opportunity just still so massive that you just put up with the challenges that have come up recently and still US kind of is the number one target?
Yeah, I mean, it's a tough one, and I've thought a lot about it. I mean, I'm definitely not doing any more corporate restructuring because it's a huge time suck and it's expensive and hard. But like if I were advising someone else who were, maybe in my shoes from a year ago or so when we flipped up, I think I would probably still advise to do it. I mean, Australia has some really great investors, and we've been lucky to partner with some of them along the journey, including 10 Mile, Main Sequence, and others. But for biotech specifically, the market is the US. You really need to be there. From what I've heard, these tariffs, and we're in this sort of uncertain period, so things could change in a day, a week, a month. But from what I've heard, US investors, if you're not a US company, actually, I've actually heard that they won't invest, and that they have someone who I had coffee with last week was telling me that one of their portcos was trying to raise from a US investor who showed them their financial model that basically has like US company, not US company, and the tariffs that would apply based on what country they were from. And basically that turning on non-US company basically meant, sorry, we cannot invest.
Wow.
So I'd say for funding and also for market, it's where it's at. For non-biotech, I think it really depends. If your customer base is there, yes, you got to be there. Yeah. So I think that's not even a question. Like the funding, maybe you could manage around that, but yeah, it's pretty tough to do from afar. I can tell you that my diary is just riddled with 5 a.m., 6 a.m. calls this time of year. And, it's something that I need to do because that's where the action is.
Yeah. Yeah.
I think we're going to have to wrap it up because we will get in trouble if we talk for any longer. Last question for you though. What's your salsa dancing like? It wasn't planned to talk about salsa in this episode, but it's come up in conversation. Claire has some other dance passions that
rock and roll.
I'd never heard of.
Lindy hop. Lindy hop.
Lindy hop.
Yeah, Google
and
it.
A quick explanation, what the hell is Lindy hop?
It's like a kind of cooler version of rock and roll.
Okay.
Yeah.
All right.
Yeah.
Nice.
Got to Google it. Got to see it.
Any secret dance styles that you gravitate to?
I'm a muso. I love music. Dancing is not my thing.
Okay.
I do not move very well. I'm like, I'll be the guy in the corner nodding his head and enjoying the tunes.
Well, what do you play or listen to?
On my way over here, I listened to an NTS mixtape that was some old school
Was it a
hip-hop.
tape?
Yeah, it was not a tape. Yeah, it was like a Tribe Called Quest mixtape.
Beautiful.
But I
cool.
love electronic music, I love indie rock, a whole lot of stuff. Anything new and different.
Amazing.
I'm
Seeing
into.
any good live shows at the moment?
I've got a gig coming up in another, I think it might be next week actually, which is Sigaros at the Opera House.
Nice.
Which I am super
be
jazzed
beautiful.
about. I've seen them a couple times, but not since like, the
Yeah.
early 2000s.
Hey, from Iceland?
They are, yeah. And they play guitar with the bow from memory
Yeah,
and
awesome.
sing in a Icelandic language that is made up or no longer spoken. My facts aren't straight, but it's going to be beautiful.
Yeah.
So
Everything's better at the Opera House, right?
Absolutely.
Yeah.
How good's
Yeah.
that?
True.
Well, Josh, Ismin, thank you so much for joining us. Been amazing to hear about the journey, your story, get to know you a bit better.
Yeah.
So, yeah,
Thank you
pleasure.
so much.
Thanks for having me.
No, pleasure.
And Claire Bull, thank you for joining us as a co-host today.
Thank you so much for having me. I've had so much fun.
It's been a blast.
Thank you.
Thanks everyone for tuning in. Obviously, you can subscribe to this on the podcast, wherever you're listening to, on YouTube. It's a video too, if you're just listening to us. So check it out wherever you want. We're on the Startup Daily website, obviously, as well. This is produced by Pinstripe Media, so thanks to Maddie J for producing this episode. Thanks to the help of Ella Walsh and James Vass, and also Vanta, of course, for supporting this series. We'll catch you next time.